Hello everybody and welcome to our training today. This is a required training topic that is in both our pre-service requirements and our annual training requirements, recognizing and preventing shaken baby syndrome and abusive head trauma, understanding and using safe sleep practices and preventing sudden infant death syndrome, and understanding early childhood brain development. So you can see here we got a lot of information to cover in this short little training today. I appreciate all of you being here on a Saturday morning for this special Saturday Tim at 10. This training is being done live for participants that are able to join us on this Saturday morning. It is also being recorded for those that were not able to make it live. You can watch the recorded session if that is what is most convenient for you. With that being said, if any of the material that we cover today, you want to go back and hear it again, just for clarification purposes, you can always go back either on our website, timthetrainer.com, or on Facebook and rewind the video, watch it again, share it with someone who may benefit from this information, all of that good stuff. Before we get started, let's go over some training tips to help you be successful with your professional development requirements and to be able to grow as a proud early educator in your program. Remember, we're always looking for willingness. We are always looking for ways to be better in the classroom, different ways that we can keep our children safe and healthy. We should always be humble and hungry for new information, new practices, new techniques. This training today has been approved by the Texas Early Childhood Professional Development System, otherwise known as TechPEDS. Most of you probably have a TechPEDS workforce ID number, especially if you are participating in Texas Rising Star. If you do not have a TechPEDS workforce ID number, I strongly encourage you to get this taken care of. It's going to be a requirement across the state in the very near future, so it would be best for you to be proactive with that. If you need assistance with getting your TechPEDS workforce ID, we do have a link on our website. Whenever you go to your profile, there's the field that you can enter your TechPEDS ID. If you click on the little help icon, it will give you the directions on how to sign up for that. Make sure that your personal TechPEDS ID number is entered on your Tim the Trainer profile before you complete your assessment for this training. That way your training certificate will automatically be uploaded into your personal TechPEDS account. It makes your life so much easier. It makes your center director's life so much easier. It's really good stuff right there. All right. Make sure that you're taking notes as we go through this material today. If you have any questions, reflections, suggestions on policies and practices to enhance your program, you want to be able to take those notes back to your center director or your leadership team so that y'all can have open-ended conversations about that and hopefully be able to move forward and grow. If you do have any questions about the training material that we're going to go over today, there are 3 different ways that you can interact with me. Of course, those of you that are participating live this morning, you can ask questions there in the chat or the comment section. If you're watching the recorded video, you can message me from our website, timthetrainer.com, in the upper right-hand corner. You can send a message to us directly through our website. You can also call or email with any questions you have about today's training, or if you need more information beyond the scope of the training material, and we can respond to you in a timely manner. Just a friendly reminder again to keep you in compliance with child care regulations and Texas Workforce Commission. Trainings must be completed in a reasonable amount of time, which basically means you cannot complete more clock hours of training in a single day than the number of hours that you worked. All right. Definitely, you cannot complete more clock hours of training in a single day than there are hours in a day. All right, so want to make sure you're careful with that right there. All right, so quick introduction. Why are you doing this training today? Well, of course, we want to make sure that we're keeping our children safe and healthy. We need to understand what shaken baby syndrome is, what infant sleep safety guidelines are, sudden infant death syndrome, and of course, understanding brain development is going to help you in the classroom. But you'll also see right here that with the child care minimum standards, any caregiver working with children under 24 months of age, so that would be your infants and even your younger toddlers right there. This training is required as part of pre-service for new employees that are working in the early education industry. You also see that this is an annual training requirement, so you must have this training every single year. And I know some of you, you've been working in the child care, early education industry for a long time, and you're like, oh, but I get this training every single year. Okay? Y'all remember, as soon as you become complacent, all right, as soon as you think to yourself, oh, I got this, that's when something's going to happen in your classroom. So you got to keep your brain fresh. You got to keep your practices fresh. All right? Things change. And I'm going to talk a little bit today about how things have changed quite a bit when it comes to these very, very important topics right here. Okay? So don't ever think to yourself, I've been doing this for 25 years. I've done this training every single year. I've got this. Because that's when something's going to happen. All right, let's talk now about shaken baby syndrome right here. Most of the time, shaken baby syndrome occurs when adults are frustrated and angry with children and they shake them. Many well-trained, responsible people who could never dream of hitting a child or think of shaking a child, they do this right here, okay? Or they think, oh, that child needs a good shaking. All right. A lot of times when responsible adults have this behavior, it comes online unconsciously. So this is why you've got to be so focused on this, and you've got to keep yourselves in the higher centers of your brain, keeping yourself nice and composed, because that unconscious mental model will kick in, and this could happen right there. All right. Now, the thing about it is, even if you're like, oh, just a little bit of a shaking right there, this effect may be far more dangerous than they realize, okay? Babies are fragile. Babies are fragile. So just a small little shaking, all right, whenever they're crying, whenever they're in distress, could cause huge harm to the baby, all right? What is shaken baby syndrome, you might be asking? When a baby is shaken, the head moves back and forth. This sudden whiplash motion can cause bleeding inside of the head and increase pressure on the brain, causing the brain to pull apart and resulting in injury to the child. This is what's called shaken baby syndrome, and it is one of the leading forms of fatal child abuse. A baby's head and their neck are susceptible to head trauma because their muscles are not fully developed and the brain tissue is very fragile. Head trauma is one of the leading causes of disability amongst infants and children. The baby's head is just too large and it's too heavy. It makes up about 25% of their total body weight. Their neck muscles are too weak to support that big head of theirs. Sometimes whenever I do this training in person, I will get like Jello cups, right? And get some little cups and put like a tablespoon of Jello in it. And then put the lid on the cup and then shake the Jello. All right, and just keep shaking that cup of jello and keep shaking that cup of jello. And what eventually happens right there? The jello starts to fall apart, okay? And then if you just keep shaking, it eventually will start to move from that solid form to a liquid form. All right, you'll kind of see it on the sides of the cup. You've got a liquid kind of oozing down right there. Y'all, that is exactly what happens inside of the head. Whenever you shake a baby and the brain is bouncing between the skull walls, that's what it's like. So if you are a visual person and you kind of need to have that visual of what this looks like and what's going on in there, shaking that jello is a really good example right here. Shaken baby syndrome occurs most frequently in infants younger than 6 months old. However, it can go all the way up to the age of 3. Now, previously, when we've done these type of trainings, we talk about shaken baby syndrome is very common up to the age of 2. And we've got a lot of research now that's now pushing us all the way up to the age of 3. All right? So kind of keep that in mind right there. That's why I believe personally, even though child care licensing requires this training for caregivers working with children under 24 months, I believe this training should be required for everybody. All right? Because it's not just, the 2-year-olds and younger that could have this type of situation. It's everybody right there. Often there are no obvious outward signs of inside injury, and especially in the head or behind the eyes. In reality, when you shake a baby, if only for a few seconds, it can injure that baby for life. All right? These injuries can include brain swelling and damage, cerebral palsy, mental retardation, developmental delays, blindness, hearing loss, paralysis, and even death. When a child is shaken in anger or when a child is shaken in frustration, the force is multiplied 5 or 10 times greater than it would be if the child had simply tripped or fallen. So how does this happen right here? All right. Often frustrated people or other responsible people responsible for the child, kind of does this in a very harmless way. And it's often to be able to get the baby to stop crying right here. The number one reason why a baby is shaken is because of constant crying. Almost 25% of all babies with shaken baby syndrome die. Okay, listen to that again. Almost 25% of all babies with shaken baby syndrome die. It is estimated that 25 to 50% of parents or caretakers, they aren't even aware of the impact of shaking a baby. All right? When the shaking occurs, once again, the brain bounces within the skull cavity, bruising the brain tissue. The brain swells, creating pressure, and leading to the back of the eyes bleeding. This is where blindness can come from right here. Some of the blood vessels feeding the brain are torn away, leading to additional brain damage and abnormalities. Blood pools within the skull create more pressure. All right. So the reason why I'm telling you all this is that, when you're looking at shaken baby syndrome, you're not always going to see the immediate impact. All right. You're not going to notice right away that there is damage right there. You're going to notice this damage over a period of time. I understand, especially in a group setting, when you're caring for, several children at one time, the adult always has to regulate first. Okay. We cannot expect to co-regulate a child until the adult is regulated first. And it is our responsibility as the adult and as the caretaker to download calm to a child. Now, y'all know I talk a lot in my trainings about creating a felt sense of safety. And children need that felt sense of safety. All right? Even in an infant room where you've got nonverbal children and their crying is their form of communication. Crying signals the caregiver that they have an unmet need. All right? The way you calm and the way you download calm is going to be critical for that felt sense of safety. When we talk about understanding brain development here in just a little bit, this is also really important. So when you have a child that is crying, the best thing to do, hold that child against your chest. You want your heart and the baby's heart to be up against each other. We call this chamber to chamber. All right? And when you put that baby up to your chest, chamber to chamber, take those deep breaths in through your nose and exhale. And you want your exhale to be about 3 times longer than your inhale. Okay? Now, you've got to have that calmness. Okay? And you've got to remember your autonomic nervous system. Okay? And your autonomic nervous system is based on your mental models. It's based on your life experiences. But kind of think of this internal clacker that you've got right here. Okay? And normally, you know, we're nice and regulated like this. When things get stressful, when things get chaotic, when things seem to get out of control, our autonomic nervous system speeds up. All right? And our sympathetic system is activated. How many of you sometimes you just kind of feel jacked up, right? Your heart rate is pacing. All right, you kind of get hot inside, your face kind of gets hot, your head feels like it's sweating, but that's your autonomic nervous system in overdrive right here. Okay? Y'all know what that feels like. Guess what? That's exactly what the baby is feeling too. Their autonomic nervous system is also activated, and they're in a sympathetic activation. All right? So that's why when we hold the baby, heart to heart, chamber to chamber, we've got to slow down. We've got to slow down the internal clacker. And not only do we need to slow down our internal clacker, we've got to slow down the baby's internal clacker. Okay? So that we can open that window of tolerance. So that's why you notice I'm holding the baby just like this. Now you might notice that I'm not doing this number. Okay, this is what our grandparents did to us. This is what our parents might have done to us. You want to pat the baby on the back and rock them back and forth. Okay, I'm going to encourage y'all to practice limiting that. Number one, you need to be nice and soft right here. Okay, nice and soft. You do this too hard, and especially the rocking while you're patting, this could lead to shaken baby syndrome. Practice being nice and still, holding that child, comforting that child, and downloading calm. And that's what we're going for right here. So when we look at some of the immediate consequences to shaking a baby, the breathing may stop, the child could have seizures, limp arms and legs, excessive drooling, the heart may stop, and death. We talked about the autonomic nervous system. We want to keep this regulated right here. When our arousal system kicks in, when we get jacked up, we get triggered, the world is not going our way, and that autonomic nervous system speeds up and it goes into a sympathetic state. Okay? When you are in that sympathetic state, and if you continue to experience distress, all right? And then you get into extreme distress, right? And this thing is just going crazy at that point. You will eventually hit a breaking point where you go down and you come out of your sympathetic system and into your parasympathetic system. It's when the body just basically shuts down. This little clacker thing right here just kind of stops, right? Which explains when we look at breathing may stop, limp arms and legs, excessive drooling, the heart may stop, all right? That is the parasympathetic system kicking in, and it's basically the body preparing to die. Everything kind of shuts down. You know, you might have seen this in some of the other classrooms working with other children who are having tantrums or experiencing rage. You know, their autonomic nervous system is going 1,000 miles an hour, and then all of a sudden they just crash and burn, you know, and they just will kind of pass out, right? And that's kind of that cue right there that they've reached that excessive point, which creates trauma, right? And then we go in from trauma to intense trauma, and then your body shuts down. Long-term consequences to shaken baby syndrome: learning disabilities, physical disabilities, visual disabilities, speech disabilities, seizures, and then once again, death could happen after the fact as well. So what can we do to prevent this tragedy? Of course, we talked about the self-regulation and the breathing right there. If you do notice that a baby has been shaken in an aggressive way right there, call 911 immediately. Take the child to the emergency room. Bleeding inside of the brain can be treated. Immediate attention will save the baby and many future problems right there. So again, the adult has to constantly practice self-regulation skills daily. And when we talk about practicing self-regulation skills, you don't just practice self-regulation skills in the moment of a trigger, okay, when the world is not going your way. We should be practicing self-regulation and composure when we are in the higher centers of our brain, when we're not in distress, all right? When we're not triggered. We have to practice these skills constantly. I work with so many schools and so many teachers who only want to practice active calming techniques when they are in that moment. And it's not going to work that way. You've got to practice those self-regulation skills, those calming skills, all right, when things are going well. All right, there you go. Of course, never throw or shake a baby. You know, sometimes we see this. Woo! Woo! Oh, y'all, I know that, you know, you will do that at home, and we see people do those type of things. Y'all, this is very dangerous. Very dangerous. Make sure that the baby is fed. Make sure that they are burped properly. That's where the crying comes from time to time. It's that pressure in the chest right there. Make sure that their clothing is not too tight. We want them to have that felt sense of safety. I know that sometimes when we have secure fitting clothing, it does create comfort, but I've seen many times where infants, it was too tight and uncomfortable for them. Always make sure that you're providing adequate support for the baby's head and neck. All right, remember, those muscles are not fully developed. They're very, very fragile. All right, if we don't provide adequate support to the neck, all right, it can create some very lifelong injuries right there. Soft music or sing to the baby. I'm going to recommend all day long, every day, that you're actually singing to the child yourself. They want to hear your voice. Your voice is going to be more soothing than any recording that you can play. All right? Infants prefer to hear their caregiver's voice. You know, I talk about this, you know, we do a lot of trainings on, you know, reconnecting with your passion and passion and purpose and those type of things. And I ask people all the time, what is one of your greatest childhood memories? And the number one answer I get when I ask people what is their number one childhood memory is people will say things like hearing my grandmother sing, my mother singing to me at night when it was time to go to bed. I mean, we hear some form of singing in the majority of the responses right there. All right. So, and it needs to be soothing and comfortable music. Sometimes I walk into an infant room, and whether it's music that's playing or one of those sound machines, don't get me started on those because I have a lot of issues with the sound machines, y'all. They're not used properly, all right? But that sound machine or that music should be played at a comfortable level, all right? People tend to play them too loudly, all right? And you walk in the infant room and it's like, you're like, whoa, that's too loud. All right, y'all, it's too loud for that child too. All right, comfortable setting. Download calm constantly, even when the world is going our way. Even when things are well, we need to be downloading that calm. Don't be embarrassed, all right, to ask another caregiver to take over for a while. If you feel like your autonomic nervous system is getting jacked up and that arousal system is really starting to pick up, y'all, that is your cue. Someone else needs to take over. I need to step away for a moment right there. We have to hold each other accountable. If you're working in an infant room with another caregiver and you see that the other caregiver is getting triggered, right, and they're not practicing composure, you are responsible for saying something. Hey, you seem frustrated. Why don't I take over for a moment? All right? We have to hold each other accountable and we have to support each other. All right? Don't be afraid of that. We want to create a culture of accountability. All right? That's what it's all about. Don't pick that baby up. Don't pick this baby up until you feel calm. If you need to take a couple of deep breaths, 3 or 4 deep breaths before you pick this baby up, I encourage you to come up with active calming techniques in your classroom for you, the adult, so that you can calm before you pick up that child. And then hug and cuddle that baby gently, like I demonstrated a bit ago. All right, let's move now on over to sudden infant death syndrome. Sudden infant death syndrome is a diagnosis given for the sudden death of an infant, typically 1 month to 1 year of age, that still remains unexplained after a complete investigation. So if you have a child that dies of sudden infant death syndrome, they're not going to immediately name the cause of death, sudden infant death syndrome. There is a thorough investigation that is done before you get to that point. Sudden infant death syndrome is an unexplained death. All right. Typically, again, this happens between 1 month and 1 year of age, but we are starting to see this all the way up until 2 and 2.5. All right. Now, again, this is an unexplained death, so it's really hard to pinpoint, what causes sudden infant death syndrome. But there is a lot of research out there that is pinpointing the overexposure to screen time, okay, that could lead to sudden infant death syndrome. This is why, the American Pediatric Association or the American Association for Pediatrics strongly says no screen time for children under the age of 2. All right, it messes with the neuroplasticity in the brain. You can see here 91% of deaths occur before the age of 6 months. There is an increase in the number of incidents during winter months. Sudden infant death syndrome is more common with male children than they are female children. Okay? Again, historically that has been the case, but this is also a trend that we see changing. And over the last 5 to 10 years, there have been more and more incidents with sudden infant death syndrome with females. Okay, it's still more prominent with males, but we're seeing more with females as well. SIDS is not something that's hereditary. It's not something that's contagious. It's not something that's caused by immunizations, choking, suffocation, or apnea. And sudden infant death syndrome is not child abuse. Okay, it is an unexplained death. So those are some of the misconceptions right there. When they look at the risk factors right there, mothers that are younger than 20 years of age or their first pregnancy have a higher risk factor. Mothers that either had late or no prenatal care, premature or low birth weight infants have a higher risk. Mothers that smoke during pregnancy, the risk is increased by 3 times. A child being in a smoking environment after birth, that increases the risk by 2 times. Mothers who abuse alcohol and drugs during pregnancy, and infants who are placed on their stomach to sleep. So these are some of the risk factors that have been documented by research. How do we reduce the risk of sudden infant death syndrome? All right. And again, the cause still remains a medical mystery, but mounting evidence from research suggests that some SIDS babies are born with a brain dysfunction that makes them vulnerable to sudden infant death syndrome in their young infant stages. Studies of these victims show many have had an abnormal brain that is likely to be involved in controlling the breathing and waking during sleep. Okay. Other things that you might want to things that you want to consider right here. If a parent of the infant is breastfeeding, encourage them to provide bottled breast milk that is clearly labeled with the child's name for feeding while in care. Check that the infant's sleeping environment. Check the infant's sleeping environment frequently to ensure that the sheets are tight-fitted and soft bedding or other objects are not in the crib. If you have a child in care with reflux, respiratory disease, or upper airway malfunctions, be sure to obtain documentation from the child's healthcare professional that give those recommended modifications for sleeping positions. If a child in your care is not breathing or is unresponsive, call 911 immediately, begin CPR, and of course immediately notify that child's family. If you do have a child that dies in your program, do not disturb the scene of death. All right, do not remove anything if possible. That's going to be very critical for the investigation right here. We're going to talk about placing the child on their back to sleep in the next slide when we talk about safe sleep practices. Same thing with the firm fitted sheet. Nothing in the crib but the baby. The crib is bare. Never place a baby on a waterbed, a sofa, a beanbag, a soft mattress, or a foam padding or pillow to sleep. When using bedding, pillows, sheepskin, stuffed toys, and other soft items should be avoided in the crib right there. Make sure that the baby's head remains uncovered during sleep. Now, of course, with child care regulations, children under the age of 12 months, we can't have blankets in the crib. All right. But even if you're going home and you're going to use these skills and knowledge at home, keep that in mind. Try to avoid overheating the baby, overdressing the baby, and of course, keep that baby in a smoke-free environment. When we talk about safe sleep practices, these are federal guidelines that have been established, that have been passed down to each individual state, and we are required to follow these in our programs. Here in the state of Texas, we do have some very specific statute. If you get cited for any deficiency related to safe sleep practices, of course, not only is that going to go on your compliance history, it could place you on corrective action with child care licensing. Your center could be closed down if you violate safe sleep practices, but you can also be given an administrative penalty, meaning if your center is cited for any of these items right here, you're going to have to pay a fine. You also have to notify parents of any deficiency related to safe sleep practices. So really, really important that everyone kind of understands these expectations. Your cribs must be meet the certification guidelines from the Consumer Product Safety Commission. All of the cribs that are used in a licensed child care facility must have a certificate of compliance. So you can't just run to the Walmart or run to a retail establishment or a resale establishment and pick up a crib for your school. There are very, very specific guidelines that those cribs have to meet, and again, they have to have the certificate of compliance. Like I said, nothing in the crib but the baby. So no pillows, no blankets, no stuffed animals, anything like that. All right. Children cannot sleep in a restrictive device. And this is the most common deficiency right here. A bouncy seat, a swing, these type of devices that you may have in your classroom. Children must be placed in their crib to sleep, and they must be placed in the crib before they fall asleep. All right? Not after. Okay? So we got to really practice that and be on top of that right there. But if child care regulations comes in and they find a child sleeping in a restrictive device, you're going to be cited for that, you're going to be fined, and you're going to have to notify all of the families. Okay? And it's just not safe for the child. Always make sure the child is placed on their back to sleep. If you do have an infant sleep exception form that is filled out and signed by the child's healthcare professional, then obviously you're going to have that on file and you're going to follow those recommendations for modifications from the child's healthcare professional. And the infant sleep exception form must be signed by the child's healthcare professional. We are prohibited from swaddling children at our licensed facilities, so be careful with that. And I understand that we've got a lot of teachers that have been doing this for a long time, and swaddling just is in their nature. All right, it is something that is prohibited in our programs. No swaddling, and of course no blankets in the crib for the children under 12 months of age. All right, let's talk about some healthy infant interactions, the good stuff that's going on in our classrooms. Y'all hear me talk so much about the social and emotional blueprint for development. And that blueprint for development is created from the 3rd trimester of pregnancy up until the age of 2. So working in an infant and toddler classroom, you've got so many incredible opportunities to create healthy and positive blueprints in that child's brain. Did you know that? Did you know that you're a brain builder? You're not just in that classroom to care for these babies. You're a brain builder. All right? Always kind of keep that in mind. Such an amazing opportunity right there in the infant room. So let's talk about some suggestions on positive and safe interactions for infants. Be warm, be loving, be responsive. Remember when we talk about, a child right here, my state dictates the state of the child. All right? So, kind of say this with me. My state dictates your state. All right? It dictates the state of the child. Children who receive warm and responsive caregiving and are securely attached to their caregiver cope with difficult times more easily when they are older. They are more curious, they get along better with other children, and they perform better in school than children who are less securely attached. I have a video on my website, timthetrainer.com, that is called Understanding Attachment Theory. I strongly encourage y'all watch that video and how important it is to create that secure, healthy attachment so that we don't end up with children that have what's called avoidant or anxious attachment. And then, of course, the worst one is disorganized attachment. We want healthy, secure attachment. And you get to create that in these infant-toddler classrooms. Infants communicate their needs, their preferences, and moods to the adults that care for them by the sounds that they make, the way that they move, their facial expressions, and the way they make or the way they avoid eye contact. Children become securely attached when caregivers read to them. All right, when they read these signals, but they read to them as well. I love reading. I love poetry. We already talked about the singing right there. All right. But then when you do want to respond to the children, you respond with sensitivity. This is going to create trust. All right. When they create trust is when they start smiling, when someone smiles back, all right, or the adult smiles, the child smiles back. When they are upset, someone will comfort them. When they become hungry, someone will feed them. This is all based on trust. And again, I understand in group setting, you may be responsible for taking care of 3 or 4 infants at the same time. You're not always going to be able to meet that child's needs immediately. But when you have healthy interactions with children, okay, and you kind of follow these techniques right here, you create that trust. Even though I may not be able to immediately meet your needs, the child knows that you will eventually be there for them, okay? Now you might think that, with this secure attachment, you may think that the newborn child or the infant is going to get spoiled by all of this attention. But studies do show us that infants who are more quickly and warmly responded to when crying typically learn to cry much less and they sleep more at night. A baby expresses their distress by crying. When the caregiver responds with food, with warmth, or comfort, the baby tends to be calm. The stress response system in the brain is turned off, and the infant's brain begins to create a new network of brain cells that help them soothe themselves. All right? We call this the attachment system. Okay? So when the attachment system is offline, the exploration system is online. When the exploration system is online is when the child can learn, they can meet the needs of others, they can meet expectations. But when the child is in distress, the exploration system goes offline and attachment comes online. And at that point, the child is seeking out their caregiver. Okay? So that's basically what this looks like right here. Like I mentioned a minute ago, talk, read, and sing to the child. Infants learn conversations even when they cannot understand what you are saying. All right. When babies hear the same words over and over again, the part of the brain that handles speech and language is developed. The time used to change a diaper or the time used when feeding an infant can be an opportunity to spend some of the individual time with that particular child, talking and singing and expanding their own goos and ga's. Read picture books and stories to the infants. By 6 months of age, infants show excitement by widening their eyes and moving their arms and their legs when looking at a book with pictures of babies and other similar objects. The most fascinating object to a child is the human face. So you want to make sure you've got lots and lots of real life pictures of human faces in your infant room. The younger the child, the bigger the picture. Okay, because an infant typically can only see about 12 inches in front of their face. All right, everything past 12 inches is blurry. So you want to get close to them and you want big pictures right there. Establish routines, daily routines associated with pleasurable feelings and reassuring, for children. Repeat positive experiences. Provide that sense of security right there. This is going to help the child learn what to expect in the environment and how to understand the world around them. Encourage safe exploration and play. And we want open-ended play. Play is an important learning experience. Look around the environment you are providing for the infant. Make sure there are enough interesting things for them to look at, but not too many. Needs to be a good balance right there. All right, but we want things that infants can focus on one at a time. Put an infant on the floor in a safe area that encourages them to move about. All right, keep containers that the infants can dump and fill. Dumping and feeling is one of the second ways children learn to explore. All right, adults should encourage exploration and then also be receptive when the child needs to return to them for security. By providing consistent and responsive caregiving, you can ensure that a child will have the best opportunity for healthy emotional and social development. Every single caregiver has the potential to help shape the young child's life and their future. Such cool stuff right there, y'all. Why should caregivers know about brain development? Well, let's kind of take a look right here of understanding early childhood brain development. The brain is the part of the body that allows us to feel joy and despair, to respond to others in a loving way or in an angry way, to reason and to simply react. These capabilities don't just magically appear. They're the result from play between the child and the adult and child and the other caregivers in the classroom. All right, it's creating and molding their mental models. Okay, we can spend 6 hours in this training talking about mental models and how hereditary that is, but we're not going to go there for the sake of time. When a child is born, the brain is unfinished. Okay, the way infants interact and experience provides them the major impact on the development of their emotional system, their learning skills, and later functions in life. We talk about this quite often. Connections on the outside create connections on the inside. Y'all say that with me. Connections on the outside create connections on the inside. That's what we're going for right there. At birth, the brain contains about 1 billion brain cells that are yet to be connected into functioning networks. By the time the child is 3, the brain has formed about 1,000 trillion connections between these brain cells. Some of these connections become permanent, while some of these connections disappear as the child grows. Well, how does the brain know what connections to keep? Connections that are used over and over again, connections that are repeated during the child's early years, becomes the foundation for the brain's organization and functions throughout life. Okay, so if a connection is not used, it's going to disappear. All right. So, for example, a child that is rarely spoken to or read to or is rarly sang to, all right, in the early years may have a difficult time mastering language skills later on in life. By the same token, a child who is rarely played with may have a difficult time socially adjusting as that particular child grows older. Brain cells are designed for making connections. Each cell sends signals out to the other brain cells, and they receive input from the other brain cells. These signals, in the form of like electrical impulses right here, they travel down the length of the nerve cell. With the help of chemicals such as serotonin, they travel from cell to cell, creating these connections. All right, so that's why repeating, okay, it's just going to strengthen these connections. All right, so there's your little neuroscience lesson for the day. When we look at the principles of brain development right here, the outside world helps shape the brain's wiring. The outside world is experienced through the senses. So seeing, hearing, smelling, touching, and tasting all of these right here enable the brain to create and modify these connections. So that's why we say so often in early childhood programs, okay, early childhood programs should be sensory based, okay, seeing, hearing, smelling, touching, and tasting. That's what it's all about for us. The brain operates on a use it or lose it principle. So that's why that repetitiveness, the structure, the predictability is also important. Relationships with other people early on in life are the major source of development of emotional and social parts of the brain. We want to encourage appropriate brain development. As a mother feeds a child or as a caregiver feeds a child, they gaze into the child's eye. A father or a caregiver talks gently to the newborn child, as they change the diaper right there. Again, the caregiver singing to the child to sleep. These are everyday moments that are simple, all right, loving encounters that provide essential emotional nourishment. Touching, rocking, talking, smiling, and singing all affect brain development. Babies experience relationships through their senses. They read the way you look into their eyes. They also see the expressions on your face. These expressions on the face are so critical right here. They hear you cooing, they hear you singing, they hear you talking, they hear you reading. They feel you holding them and rocking them. And they take in familiar smells. Physical touch is especially important. Holding and stroking, and this stimulates the brain to release important hormones necessary for growth. We know children must have physical touch to survive. All right? Children may not survive if they don't receive adequate physical touch. It's so incredibly important. I know that was a lot of information in a really short amount of time right here. We've got lots and lots of other trainings on our website that go into deeper detail on a lot of these particular topics. This right here is kind of the base model for you per se. If you have any questions about any of the material that we covered in today's training, please reach out to me. Again, you can send me a message through our website, timthetrainer.com, up in the upper right-hand corner. You can call us, you can email us, and we're here for you. We have so many resources that we can refer you to or give you some guidance on so that you can create that healthy, safe, and supportive environment for your infants and toddlers. All right? But I just want y'all to really understand the potential and the impact that you have on these children's future every single day when you're in that classroom. Okay? You got this. You got this. All right. Awesome. Thank you so much. I'm going to go ahead and post the link for your assessment. If you're needing a certificate of completion for this training today, you can complete that assessment. Even though this video may be done, you're not done with this training yet. I'm going to give you a little bit of a homework assignment. Okay? First off, I want you to take some of the information that we discussed today, especially when we talk about healthy interactions, when we talk about the environment, when we talk about safe sleep practices, and I want you to go back to your classroom and do a reflection. Honestly, do that reflection of your classroom, okay? What type of improvements can we make? How can we elevate the care for the children that we're giving in that classroom? I want you to have open-ended conversations with your coworkers, open-ended conversations with your leadership, your school director, about how you can enhance and elevate your infant and toddler classrooms. Okay? So these are some of the homework assignments that we've got for you. I also want to strongly encourage you to do a comprehensive overview of the basic care requirements for infants and toddlers in the Child Care Minimum Standards booklet. All right, make yourself very familiar with those basic care requirements. It is everybody's responsibility to know and comply with the Child Care Minimum Standards. If you are aware of another caregiver who is not following and complying with the minimum standards, it is your responsibility to report that to your center director. We have to hold each other accountable. But you got to know the stuff first, right? So that's why I want you to do a comprehensive review of the basic care requirements for infants and a basic care requirements for toddlers. So that's kind of your homework assignment that's going to go along with this training video right here. Okay, so that's why you're getting 2 hours of training for this topic rather than 1, because you got some additional work that you need to do right here. All right, fantastic. Thank you all for joining me today. I hope this was helpful. Hope to see you all very, very soon at another training event. Have a very wonderful and blessed rest of your day. Thank you for all that you do. Bye, everyone.